Ouais. Ouais, on a l'écran là-bas. Ok, cool. work on this thing. No record. You're not going to continue. You're not going to continue. Hello? Okay. Yeah, that's what I'm talking about. It's only 2 minutes. The girls don't know why they want to know. The girls don't know. I'm going to start with the women. So, what the first thing to do? Okay,
Good evening, good evening, good evening. Can somebody say hi? Hello, hello, hello.
Good evening,
Good evening, ma.
doctor.
Hi,
Good
Doctor.
evening,
Good
doctor. Good
afternoon.
Good
evening, ma.
evening, doctor.
Good
Good
evening.
evening.
Good
Good
evening,
evening, good evening,
Good
doctor.
evening, doctor.
good evening.
Good
Welcome
evening.
back.
Good
Welcome,
evening.
Good
welcome.
evening.
Good evening, doctor.
Good
Good
Always
evening,
celebrate to hear your
doctor. God
voice.
bless
Good
you.
evening. God bless
evening, ma'am.
you.
Good evening,
Amen,
Good,
doctor.
amen,
good
amen,
to hear
amen.
you again. Thank you.
Same here, ma'am. Same here, ma'am. So then we also want to pray. Let's pray individually for the Texas people. Oh, it's not happening in our own Texas, but the other Texas have been affected. I'm not sure whether we have a lot of our people there. So
Texas.
we just pray that the soul of those that are departed will be accepted.
Amen.
So we pray that we don't experience that anymore. It has been
Amen.
a black week for Texas in the past 3 or 4 days
Oh my God.
for the flood.
Mm.
I will just to mute us and start. Good evening, good evening. I'll just make my disclaimer and we can start. My name is Dr. Kemi Akinlao. My number is 281-372-9148. I don't have any connection with NCSDN. I don't have any relationship with Pearsons. Neither do I have any connectivity with anything that has to do with NCLEX. I don't have any NCLEX question. I've made 100% disclaimer. If you peradventure see any part or all of any of our questions in the exam, I have made 100% disclaimer. I don't have NCLEX question. I don't have any connectivity with NCLEX. We are only trying to be resourceful. So once you come on Sunday, yes, so we are going back to our single item NGN and the traditional mixed together. We've done case studies in the past 2 weeks. So go back to our traditional question and some of the single item questions. So we are expecting you to spend about 3 minutes on it. Anyone that I think it is extremely worded, if I make it so like a comprehension intentionally, I'll make it more than 3 minutes. So for those that are just joining, once we come in like that, we don't talk in the first maybe 1 hour, 30 minutes or 2 minutes. You come in, you do the questions by yourself. How far can I go with this? If I were to be given this question in the next 1 month or 2 weeks, if you get 35 to 50, you are good. Your content is good. You are not expected to pass all the questions in the exam, though. You're still allowed to fail 15 questions. So that's fine. So if you get 35, Just pat yourself at the back. You are doing good. If you get more than 35, fantastic. Fantastic. Difference between being good and being great. 35 is good. 45, 46, 47, that is great. If you get less than 35, you might still need to work more on your content. You are still not there. We are still not going to disconnect from you. We are all still together. We all are still in the game until we pass the exam. Don't give up. You have done the exam many times. The only thing that will make someone to fail NCLEX entirely, it is if that person has given up and said, this thing is not for me. They didn't write anybody's name to be an RN or helping. It is the person that is intentional. I will go back and I will still pass. Those are the people that will friend or helping in the long run. So don't give up. If you have done the exam many times, keep pushing, keep pushing. You're gonna get there. And that's that. I will change this to a slide mode and we can start now. On no account can any of our product be shared. If you screenshot, if you snap, it's going to be part and parcel for you. Don't at any point in time send our product out. If you think what we are doing is good, give my number to someone, let the person come to assess it. That's the only thing I frown out. Sending out my products, trying something hanky-panky, I don't really like it. Just do what is right. We all are preparing or praying to pass this exam. I always tell people, if you do good in life, that good is enough for you to say, God, I've done good though. Come and crown my effort with success. But that person that is manipulative, that is doing something wrong, he or she also knows that I'm not doing something right. So when the prayers don't get answered, I always tell people, can you go back in the past? If you've done something against somebody that is passive or active, maybe you don't really know that what you are doing is bad. So let's check on that. Let's try to do what is good as an adult. So we're going to start now. 3 minutes on the question. Can you see my screen? Let's ask. Some people are saying they can see the screen. Can somebody say
Yes.
hi? See the screen? Okay.
Hi.
So that are not saying that, 2 people that say they can't see the screen, maybe it's your network. Please log out of the class and log in back again.
Patients who have sensitive teeth but also want whiter teeth, they have to make a choice, one versus the other. Sensodyne Clinical White provides 2 shades whiter teeth as well as providing 24/7 sensitivity protection. Patients are going to love to see Sensodyne on the shelf.
This is Protection, the everyday skin protection ritual that protects your skin from mosquitoes. The #1 best-selling mosquito repellent brand, putting everything on. Prevention is the best protection. Ask D. Johnson.
That's great, but can you ask your friend to start taking this as well?
I can ask.
What is that going to? Only pay.
Summer is here, and Wayfair's big 4th of July clearance is on now. It's the talk of the neighborhood. Right now through July 6th, get up to 70% off everyday home, so you can celebrate all summer long. Plus, 4 amazing surprise flash deals for just 24 hours. And get it all with fast shipping straight to your door. Save up to 70% off Wayfair's 4th of July clearance, now through July 6th. Kickstart or 4th of July weekend with unbeatable savings. Whatever the moment, make the cocktail. Unbox, vaulting big cocktails. 2 summer sensations are flying in the DQ. One is sure to save the summer, and the other, yeah, he's Superman. Hurry in for the new Superman Cake Batter Cookie Dough Blizzard Treat. Right now at the DQ.
Right now at the Home Depot, shop 4th of July savings on GE Profile Appliances. Sleek outside, tool dispense inside, and all-in-one laundry that can wash and dry in one machine.
What do you mean off your side, right? back home, and as usual, when my wife heard it, she got angry. She started giving me attitude, saying all sort of things to me. So it got to a point I just had to leave.
I guess mine finally added up. Guess I'm gonna run away from her.
She said she was to go out to meet some boys. So she left the house. I went to the closet, picked up my backpack and official documents and my jacket, and I left the house. I walked for about 5 hours.
What? No!
You walked down this long road?
If you ever need a motivation, call Michael. He's a transformation level one. It's sad. It's really sad. It's sad that he walked for 5 hours. Like he walked just he was so desperate to get away.
I mean, dude, this is insane. At some point, I almost got beaten by the dog. But God saved me from that. He couldn't beat me.
Great. Michael is definitely a true definition of never give up when you try. Really? Like, man, get it. What's
Sit
your
back,
name?
I'm this boy's own nation. Here for the right reasons.
I mean, come up with some new lines. Don't be so far-fetched.
I want to live all of my life. Enough is enough. No one deserves to take this way. And I mean, I want the best for us, for myself. But it's also unfortunate I can't just take it anymore. So you're gonna go back home to Nigeria? Just done.
Don't.
Yep.
Oh my gosh, I never thought I was gonna see this.
I'll see you soon, Michael. I'll see you soon. Are you getting on the plane? I'll see you soon.
Whoa!
Well, you gotta fly me, but honestly, after this, Michael and his relationship has to be over. There's no coming back.
There's no coming back.
No.
They both are. She was by being like so mean and so rude and so weird and nasty to me. And he ran away. So they both, no one is good in that relationship.
Honestly, Mom, I'm kind of glad that we're seeing everything out there. Just hello, just so you know, Michael's okay, everything's safe, it just was insane.
But you know what? Their story is finally finished.
It's clarity. We got some clarity of bliss, that's for sure. But this is
Finish.
just
But why are you watching us?
man. This is over.
What? Let me just give you one more with this tail.
Wow, that was wild, especially at the end.
Well, the good season, right?
Oh, oh,
Darcy's texting me.
oh, wow.
Wow, I haven't talked to her in a long time. Let me go text her back.
This tell Laura's making me want to drink more. Let's go throw it 5 times.
Totally get it.
why I would not do Moldova. One is it on the financial side because it's very cheap to live there. You live here in the city, you know. The same, you know what's happening with everybody there. All the investment is junk. And the rest of the cult is cut off from our life. That's it. All right, let's go.
He's just ready to go full ahead. He's lived there before, he understands how the country works and everything, he knows people. But for me, it's almost like the only way to see if this is going to work is to just go there and just scope it out. So in 2 weeks, we will be taking a trip to Moldova.
I think it's going to be great. I think you're going to love it.
I'm going to go there with an open mind, but I'm not making any promises. What sound do pirates make?
Okay, yeah, hell yeah.
So Miami should be fun, right? Us will be fun.
Who's going to be there?
I know Joey and Jar are going, but I don't know who else. It's going to be so much fun, right? Lauren and Alex invited us to their housewarming party, so we're going to head down to Miami for the weekend and have some fun. It'll be nice to hang out in the boat. The kids can play with each other. Lauren and I have been friends now for about 4 years, and we talk all the time via text. And initially, we bonded over the fact that we are both married to Eastern European type guys. Her and I lean on each other when our husbands are driving us crazy. We don't know Jovi and Yara that well. I think Yara's funny.
I met Jovi a couple of times. One time at the pillow, we didn't start on the right foot, I would say. We had a little bit of a cold thing.
You usually really stand there manipulating all the time and trying to get funny message out. You can't get a follow up on those letters.
You don't think that we have a supply of friction? This is true. Wow.
The singles thing happens a lot.
I saw a job where I came after that. Already. But I really think that Jovi is not going to have it with a kid.
I really like Yara.
Really?
She's from Ukraine, and that's just next door. So hopefully she can give me some advice on Moldova.
Advice on your way. Let's not listen to us, but let's listen to Yara.
She's a woman.
Oh my gosh, but she's a woman. Is that not the committee over there and decide what pay for the whole? Think that's going to change your opinion?
I think it would be a good conversation to have with them and kind of get their opinion on it.
I don't know why you need somebody else's opinion. I grew up in Moldova. I know how it is to be living there. You need to hold
told people who can use your customizes your car insurance, so how much do you need?
Last time, I forgot. I thought I was deeper than that. Only pay for it. Every day is every day there. This is good. Each time you see that tree, close.
After 4 years of dating, I moved to the United States. Gina and I finally got married.
Well, hang out low. Routine.
After Gina and I got married, unfortunately, there was a lack of intimacy. I was not ready to be in a same-sex marriage, so we decided to go to couples therapy.
Meaning basically fight every day.
We haven't had sex like in a month. I like the therapy hopeful, but here's where it got actually. So I came with the idea of safer marriage. I had to start thinking about having a person that will satisfy that need for me. Open relationship? Yes. Gino and I decided to move forward with the open marriage agreement because Gino couldn't be intimate with me and we have another person satisfying my sexual needs. And then I thought I would be in a better mood and Gino and I will start getting along better and reconnect. I was so wrong. Gino didn't want to kick me out of the house. I stopped now.
Oh,
No,
stop.
oh, just stop. I still love Gino. We're still married and I want Gino and I to fix our problems. There is a solution for everything. But until we figure out getting my physical needs satisfied by my friend, not.
I can see why you don't get pregnant. I was wondering how to define strong sex. As time goes on, some changes in your sex drive.
Oh my god!
Finally!
I know! I know!
I thought you would be taller.
Please, can someone talk? What number are we now? Someone say she cannot, she's not seeing the screen.
23.
24.
23.
24. Okay, 23.
We can see both
We are all on.
23 and 24.
So that person, please log out and log in again. Maybe it's your internet.
At least you know I've said it to you. It's not overnight. Like I'm not gonna just pick up and leave and stay here. Like we need to go scope it out, find a school. Like a month. Find, yeah, a month, 3 weeks, a month, whatever. And then I'll see. But I'm more open to it. In the beginning, I told him absolutely not. I can see you moving abroad if you don't know Honda was the best. Doesn't it worry you? And it's corrupt and it is not like. That's why you cannot move to Moldova. Because we say that Moldova is not corrupt. America is not corrupt. It is. Yeah. I just feel like I kind of owe it to him. Do you ever feel bad that you like essentially took Alex away? You know what? No. That was our choice to come here to leave from here. As I come here, you stay here. That's it. You don't owe me nothing. I don't believe that guilty, honestly. Like, I get it. He came here for her, but that's something they decided to do together. It's not him saying, I'm going to come there for you. It's both of you deciding to do it. Okay, so truthfully, could you see yourself living there? I don't know. I think what this is about is Andre trying to take his home. That's where he's from. That's where his family and friends are. That's where his support is. Andre's not taking his wife and kids into account. So it's not okay. I'm afraid. But I'm going to do it because I know that he would do the same thing. He did the same thing. He did the same thing for you, but we're talking about coming to America, not going to Moldova. Do I need to take this opportunity? I couldn't believe how beautiful you look in person. Like your skin, hair. You are adorable. I'm just so excited. You're kidding. Oh my gosh. Yeah. I'm really gonna have that pretty soon. Are you? Good, how are you? I said Victoria with the bag. I didn't know that was going to happen. And I also didn't know they were all simultaneously going to get the results at the same time. That's what I'm most happy about. I love yourself. You do venture abroad. Wow. Sorry about my shine.
Who customizes furniture?
Nice birdie. Seems a very nice birdie.
Girl, it's like work. Basically, responsible.
Whatever the noise is, it might be a godsend. Find out. Don't trust the internet. There. Take a look. Warning. Sensitive content. Tell me more of what we love.
Privacy is my biggest issue at home, especially when they've been using toilet paper
Mother.
all this time. Hold it, mister. Your child. Better.
And what if she pees upstairs?
Catch yourself.
Huh?
Step two.
I'm not the one who asked. I'm not the one who asked.
Hey, you passed the weight test and your mouth test.
I'm not the one who has her. Then she could if you want. Mm.
I Tempur-Pedic mattress right out of Mattress Firm. It's got cooling technology. So now I sleep all that match that Mattress Firm. Sleep in that. Did you know your brain has three dimensions of memory? Word. Smart. And long term. That's why we created new Narita Memory 3D. Unlike ordinary memory supplements, Narita's revolutionary formula has clinically tested ingredients that support three dimensions of memory. Take it from me. An elephant never forgets. When you need to remember, remember Narita.
Right now at the Home Depot, shop 4th of July savings on GE Profile appliances. Sleek outside, dual dispense inside, and all in one laundry that can wash and dry in one piece. Get free delivery now at the Home Depot. Monday. What's happening? No. Wait a second, what? Jesus. What is it? What's that? You okay? Well, help? Are you okay? 90 Day. Hunt for Love. All new Monday at 8 on TLC.
That number two is here. So now we're still driving. I became my friend because we frequent the same gym place. The way Matt introduced himself to me was like a lady. Like, I can do whatever I want. I'm nutritious and delicious. He said, no, you're so tiny, but look at you. Thank goodness. I cleaned the house. The house is not dirty. Don't mess up with my nap. Everything is perfectly organized and everything is as I like it. You know, we started to become closer and closer as friends. So after kicked me out of the house, Matt went and picked me up, and now it's been 4 months, and I've been living in his house. It's basically like I'm living with the roommate that occasionally sleeps with. He's 37 years old. He has never been in a committed relationship. What he does for a living is buying and selling cars. It's very normal compared to you. It's not weird. I don't feel like unpacking, because you know that this whole stuff is gonna be just temporary. I don't have like much space in here. I don't have where to put my things. Like, I'm sorry that this is like this, but it was not planned. It's not even responding to me or anything. Like, I don't know where the heck. What? What is that? You're so mean. Stop. The reason why kicked me out of the house was because he was convinced that I was breaking the rules that we came up with about the overnight. One of the rules was that sexual encounters could only last 2 hours, and I was sticking to that rule. But one day I went to work out at the gym with Matt on the same day that I hooked up with him, and assume that the whole time I was skipping the gym just to go and have, I don't know, like 7 hours sex with Matt. I'm too old for that. Hopefully, this is just Gino's tantrum. I kept thinking that he's gonna believe me because I'm telling him the truth. I still love him. I'm not ready to lose him. He's my husband and the only person I'm in love with. Listen, it makes you feel very uncomfortable. It's not gonna like be forever. Like eventually I will have to figure it out things with Gino. So why would I unpack? You understand?
sleeping woman. What's a sleep? What are you gonna say? I'm like, dude, if your husband's cool with it, I'm fine. Whatever.
Where's my coffee? I'm not giving you a tip.
You don't even tip.
Bad American service. Hurry up. So how was your flight?
Take my glasses off.
Let me look through it. Is this the first time you've been to Vegas?
No, actually, I've been here a couple times before.
Okay.
It's been almost 20 years.
Okay, that's a long time ago.
You know,
Vegas has changed.
more than 15 years ago. When I first started speaking to Natalie, things got blurry pretty quickly. It was really weird being attracted to someone that wasn't my wife. But honestly, this was all Jasmine's idea about the open marriage. And so, hey, I'm going to try this out and see how it works for me because I just might like it.
Were you excited?
I was super excited, you know, to be meeting you for the first time.
I was
And
so
then,
excited. I
yeah,
was hot, nervous, everything. All in one.
yeah, you looked hot.
Ah, well, thank you.
I couldn't believe how beautiful she is in person. Like her skin, her hair. She's just more beautiful than I expected.
You are adorable. I'm so happy. All of my exes have been bald. I prefer bald.
You're kidding. Oh my God. I might be losing the hat then pretty soon.
Ah.
Try this on. Oh my gosh, it looks so good on you. That looks hot.
There you go. That's gonna work. Perfect.
Oh my God, let's do this. Oh my goodness. This is like being in Antarctica. Thank you. Wow. Y'all ready to have a cool time?
Yes,
This is
ready?
awesome. Can I get started for you? I'm gonna take an old fashioned for you. Oh man.
In my past relationships, I haven't had the best of luck with men. I'm divorced twice, and since then, I've had nothing but toxic relationships. I tend to pick the bad boys.
Yeah.
The thing about Chino that kind of made me attracted to him was the fact that he was a little on the nerdy side. He wasn't like this macho man, and so he seemed very safe. Look at that.
So this right here is our famous titty shot. Oh my God.
Okay, there we go.
Would you like to take a shot at the titty? Yeah. Titty. Okay, ladies first, ladies first. Ready?
Oh my god, oh my god, oh my god, oh my god.
Oh my God. Yeah. How was that?
Your turn. Ready?
This better tastes better than 100%. One, two, three. Wow.
Are you okay?
Oh my God. I feel like a new man now. Allie's so freaking cool. Like she's having such a good time. You know, she's not negative at all. Not arguing with her. I can't even remember the last time Jasmine had this much fun with me. Oh my God, I feel good.
Look at this.
But I am a little nervous because I haven't been totally honest with Natalie. I did tell her that I kicked Jasmine out, but I didn't get into all the details. So she has no idea that I am open. I didn't want to intrude her. You know,
Shimon.
War doesn't know anything about anymore. This is the pilot of bachelor preparation.
Domino's first ever stuffed crust pizza. Try it for the first time tonight.
Phenomenal. Try it in stuff you like. You like reading about whatever. NCLEX. There you go, Kate. Next. If you're making a to-do list today, make it easy on yourself. Just write down the pieces, then write down you need them, and then kind of done for the day.
When I picked my son, I had so many questions about his kid. I told the barn sperm it was the best call I could have made. All the barns come now. Find out what your kid is.
Car breakdown procedure is challenges. Is your car out of warranty? For real floor breakdown? That's why Albert Car Shoe Custom. Their parts will check out for 5,000 parts and systems. Saving drivers money, covered repairs. Save money. Save time. Save the hassle. Call Car Shoe now. Before a breakdown happens. Call now to save money. Your price lock guaranteed. Call 800-420-5301.
When the truck hit my car, the insurance company wasn't fair. I didn't know what my case was worth, so I called the barn sperm.
I'm Rich Barnes. It's hard to tell people how much their accident case is worth. Let our injury attorneys help you get the best result possible.
Having a surgery is a live or die situation. I'm too rude. I'm scared, but I'm ready.
Listen up. Joe Beck's £1,000 release season finale Tuesday at 10. See it first on TLC. Shot. Get on the block. Curve is running strong. Say no more.
So who's the grill master? Alex. He said he's been grilling before he was born over here.
Here's the master.
You know what this was actually? It was my in-laws gift. And now they don't talk at all. I don't even know.
My wife has the same thing. She doesn't speak to her mother like at all. So her mother, the narcissist person, doesn't want to connect. I actually don't talk to these people. Like, that's why I'm talking about moving to Moldova.
What is Libby saying about Moldova?
She's not into it, dude, but what I think is
She's never gonna be into it. Your wife's not gonna move to Moldova.
she's gonna move. I'm gonna make her move.
You're gonna make your wife move to Moldova.
Yes,
If you
I'm gonna show her it. I'm gonna give her a move to me. Really? It's moving or we're gonna separate, you know, go separate ways.
You're gonna leave her, she's not gonna move. We're gonna go separate ways.
If it's not happening, give her ultimatum.
It just doesn't make sense. It's your wife. If she's 100% not on board, how are you gonna do that? I don't know how she's gonna react to this, strong arming and ultimatums. I don't see it going well.
What you gonna do there? Think they're having fun? Like, what you gonna do there? I would be just a stay-at-home mom with a man here. And the next stop, like, we're gonna hang out. He cooks, and he cleans, but it's like things that they don't think about, we have to think about. It's like, babe, where's my deodorant? Like, did you ask me to order it? Why do you just expect me to, like, that's exactly household item. Alex cannot see me stay-at-home mom, cook, clean, do laundry, whatever, superwoman. But, like, we all need a break. You just moved here. You're down here. I hate that tomorrow. You guys can give us a girls' night out. Can you show your hands? Oh my god, do I wear heels or sneakers? Is the big question. Heels, because we're gonna dance. On the bar.
Perfect timing. We have the last
introduce it to Moldovan culture. For example, it's go to the restaurant, order with ice, with ice. I think it's a spoiled American who will be hard to get used to standard there.
Hold on a second. Can I ask something as an outsider?
Yeah.
I'm an immigrant too. Didn't you do a whole 90 days to become American and come here?
Thank you.
So wait a minute. So you decided to change your mind and drag your whole family back? Then that's not fair.
You don't know me, okay? I did the citizenship because I came here from there because I fell in love in Ireland, right? And I came here better to decide on the moment. Now there is a possibility to work my life. And to be in a place that is like really, really cheap and have the same opportunities. So what are you going to say about that? Because I want to bend my wife over because she's
Are you
American.
gonna let the other two? You're gonna keep talking over me.
Yeah, because you were
Great.
talking
Let
over.
me ask you something. I can understand Moldova because that's where you're from. But it is kind of corrupt. Like,
You know why? It's a product of a Russian war. What do you want? Lauren doesn't know anything about Moldova. She literally has never been to any of these countries. She's arguing with me why am I moving to Moldova. Really, I'm getting attacked right now, and I'm getting much support from my wife, sitting here alone, advocating for my country, like I have to actually do that. And plus, on top of it, Elizabeth listening to her and to all of these people, it's really bad for me because it's just piling up bad thoughts in her brain.
you don't think with this. I would never be caught in a country or situation that I'm not okay with.
Make sure that your family is on board. It's not something that you can force them to do.
I don't know what to do. I'm not here. Basically, Elizabeth is not on the same page with him at this point, and he's gonna make her move. I think that's straight up rude and disrespectful. I'm not, like, I'm trying to sell her on it, but I'm not forcing her to move.
But you literally told us that you're gonna make her move no matter what. You're gonna give her an ultimatum.
I didn't say an ultimatum, but I said,
Literally use that word.
okay, I use ultimatum, but I would say, like, hold on a second.
Ultimatum? What are you talking about?
Not in the first place, that's it. They don't like you.
I'm asking for your eyes.
You are controlling.
I'm not controlling.
You're being weak with everybody. I don't respect that.
You don't respect me. Nobody should be that upset over somebody hanging out with another person.
What's happening?
Yeah.
Nervous? What? Jesus Christ. Who's that? You okay? Need help?
Are you okay though? What happened?
90-day Hunt for Love. All new Monday on TLC.
Friday is coming to life. Be lucky for good deals on whatever you get into. It's the most.
With hotels and vacation rentals, Booking.com has something for everyone. We really work this way.
What about something more family friendly?
Meet me at a resort with a water park.
Or somewhere less family friendly.
Bookies Hotel from Bride to Be. Everything we have for cancellation. Find exactly what you're looking for. Booking.com, Booking.com. Right now at the Home Depot, shop 4th of July savings on GE Profile Appliances. Speak outside, tool dispense inside, and all in one laundry that can wash and dry in one machine. Get delivery now at the Home Depot.
You've asked me that 3 times now. I did? Yes. It's exactly how it started with Mom.
Worried about your brain health? Cerefolin Brain Wellness has a dual action formula that slows cognitive decline while improving memory, focus, and concentration. Those taking Cerefolin Brain Wellness experience a slower rate of brain shrinkage. Now also available without a prescription at Cerefolin.com and Amazon.
It changed my mind.
Rolf's recommended. Sarah Palin Rain Lotus.
Live life never bugged with Stem's flying insect-like trap. Made without chemical insecticides. It attracts and traps bugs 24/7. Live life never bugged with Stem.
Wow. Sorry about my shine. It's giving raw. So it's your turn. Thanks, Sam.
Hello, everyone. Get excited.
It's also inspiration to find a little less inspiration. Valsmart, affordable, durable, available with Lowe's.
Background filament. Low-level plant bacteria to cause cancer. Most toothpaste quit working in minutes, but Crest Health's antibacterial fluoride protects all day.
Stop the energy before they stop.
Crest.
So, happened to get artificial insemination.
Whitney was looking for a man.
Now she's looking for a baby. This is intentional to try to get pregnant. Here we go.
My Big Fat Fabulous Life, Tuesday at 9. See it first on TLC.
I was like, you were saying.
It's so extreme.
Stop. Oh my god, that's so cute. That's beautiful.
For your birthday.
Thank you, baby.
For us. Lately I've been working so much and we both deserve some quality time. Especially it's her birthday. Tomorrow, the big birthday bash is her twin sister. That's why I planned all this the day before so we can have some little time for each other.
Beautiful.
Like it?
I love the rose petals. You really know well. This is a little hairy, yes.
No.
Let's have a bottle.
Of course, whatever you like. Up the ball.
It's my birthday.
Happy birthday. For my beautiful wife, for your birthday.
What, are you like still the same age?
No, but
It's okay, it's 15. I know. I know.
halfway there,
Yeah.
in the hundreds.
Hopefully I last till 100.
So how do you feel being 50?
I'm aging like fine wine. Wanna take a sip?
Cheers.
Cheers. How do we say it in Bulgarian?
На здраве.
Nazdravie.
So we need to start learning Bulgarian because you're going there. На здраве.
Nazdravie.
That's very important word for Bulgaria.
Yes.
Then I don't know how to feel about it. When we're there, definitely I miss my family. I haven't seen them in a long time.
Of course.
But in person, I never introduced nobody to my parents. So you're the
moment that I'm going to be calm. And that's a big thing.
It's huge.
It's huge. I'm kind of nervous to go back to Bulgaria. Having been home 13 years. My parents have never met Darcy in person. But also, I've never met with my parents with any of my exes or with one of them. So I don't know what to expect. I just want them to accept her. And, everything to go perfect. However, we need to make sure the good impression will grow. And that's very important because in Bulgaria, good impression it's everything.
I understand.
It's not be the first place. That's it. You don't like it.
So it's one shot and one shot only.
Yeah, definitely. My parents are living in small conservative town, so showing up like that.
Like what?
You're Miami. Close and you're very progressive. Bulgaria.
I mean, I know my fashion sense, and when I go to Europe, you know me, very classy, very generic. Like I've been to Europe more than you've been, so don't school me, please.
I'm trying to help you. I don't know what my parents are going to see me show up wearing something like that.
Excuse me?
I'm asking her to cover her boots and to dress a little bit more conservative when you meet my family. She acting like I'm judging her style. But Bulgaria is only spent not too long ago, part of Soviet Union. It was a conservative lifestyle, including how the people dress, and people they still live with this mindset. If Darcy walk in my house wearing this outfit he's wearing right now, it's just gonna make my parents uncomfortable.
I have enough respect for myself and my family to go there and dress nice. I still have my style, my flair. Take that away from me. I'm okay with all this. I'm not just gonna have a rich either. You know.
I don't want to worry about it. This is we're gonna be everybody tomorrow.
Respect me. Never tell you no.
People tell people when they're ready. So
Yeah.
you're gonna profile her very quick.
Maybe
It's
they
kind of a lot of pressure on me. You need to understand that.
I've been waiting since day one to see where we came from. We've been married almost a year, and it's kind of crazy that I haven't met anybody from his immediate family in person before. And now, after hearing he wants me to cover up and change the way I look for his family, it makes me wonder, what has he even told his parents about me? What are they expecting? Because apparently ever since I've known him, I feel like I can't shake that feeling that he's hiding something. And usually never ever lies. It's gonna be a trip of a lifetime.
Hopefully in a good way.
Oh my God, stop it. That got me excited.
I am confused. I just know that I missed him.
To me, this whole situation of us not being together is temporary.
I love him.
That's great, but can you ask your friend to stop taking
Serious infections of our blood, cancers including lymphomas, serious allergic reactions, joint tears, heart attack and stroke, severe risk increases in cardiovascular heart disease risk factor, disease, infection, or COs are greatly related to inflammatory bowel infection.
To swelling, itch, and rash of eczema, talk to your dermatologist about Rainbow.
Learn how happy can make you sing. 7 years, over 7 years of archives tea. Made with real iced tea, real vodka, refreshing these days. Refreshing these ice creams, sun cruiser. This is a can about sparkles. It's also a realization that you'd rather exercise your mind. That's why. Affordable, durable, available in bulks. Kellogg's cereal. Grain, sugar, salt, malt. That's it. In case you're wondering, plus vitamins and minerals. Nice.
Friday is coming to life. We're from whatever.
Okay.
Think it's okay if I cut my biscuit?
Come on, Gina, do it. Do it. Get closer.
What's up?
Oh my God.
Oh my God, stop it. That got me excited. Jasmine hasn't made me happy in a really long time. And Natalie makes me laugh, she makes me smile, she makes me hot and sweaty inside. It's just really different with Natalie. I got some butterflies too. This is so nice. I mean, I haven't felt this good in a long time. It feels like I'm always arguing and fighting every time I go out. So it feels so good, right? To just like hold you and you're not like bitching at me. You know, what a piece of crap.
When Gino and I first started talking, he did tell me that he just wiped Jasmine. I really felt bad for him because he wasn't treated really well with his eczema. He was very hurt and he had gone through a lot. Glad you feel comfortable.
Yeah, you know,
You came.
I'm so happy that you finally meet you. You're so nice.
Oh my God.
And you're so beautiful.
Really?
I mean, when I met you at the airport, I was like, wow, she's stunning. She looks so much better in person.
Do you know what Gino did? He changed the locks.
So you went to his house. Why?
To pick up certain things.
You didn't see her.
No, but he changed the locks. What does that tell you?
I don't know.
But he acts like he's old and bitter about it.
I wouldn't be too sad or anything. I mean, it's not like he helped you with anything. He doesn't want to give you anything.
But I love him. Have you ever loved anyone?
I don't know.
The few times I've been back home just to pick up a few personal items, Gino refused to talk to me. He doesn't even look at my face. We have never had a conversation about what the status of our relationship is. I brought Matt into my marriage just to satisfy my sexual needs. So it was not about getting attached. It was not about having a romantic relationship. He's just a friend. I didn't have any other choice because Gino literally said that he couldn't see himself being intimate with me anytime soon. But to me, this whole situation of us not being together is temporary. I am confused. I don't know. I just know that I miss him and that he doesn't want to talk to me and that I don't know what he's doing. I don't know what to do because I married this guy and I've been with him like for almost 5 years and I envision my life together with him. I don't know if he has stolen my memory. I don't know what the is going on and I feel like this open marriage just ruined everything.
Going to another country is a big move, Andre.
How do you know that you're gonna do it?
I didn't say she couldn't do it.
But what do you
I
think about
said
this?
what she exactly.
That's what you think.
How do you think?
Next Sunday.
I know I should feel guilty because I'm a married man.
I need for Jasmine to know we moved on.
This is getting really complicated.
Happily Ever After. All new. Next Sunday at 8 on TLC.
Wow. Sorry about my showing. It's getting lost. So is your hair. Thanks, Sal.
Right now at the Home Depot, shop 4th of July savings on GE Profile appliances. Sleek outside, dual dispense inside, and all-in-one laundry that can wash and dry in one machine. Get free delivery now at the Home Depot.
$5 duo LPK. Step up to the plate and have it your way. Get two of your faves. It's up to you. Just figure it out. Then hit the track. BK. Have it your way.
Sunny days call for Sun Cruiser Vodka Iced Tea. Made with real iced tea, real vodka, refreshing and rose-bound smooth. Let the good times cruise with Sun Cruiser.
Whenever heartburn strikes, get fast relief with Tums. So you can enjoy love.
Kellogg's cereal. Grain, sugar, salt, malt. That's it. In case you were wondering, plus vitamins and minerals. Oh, and ice cold milk.
Dr. Rick, we are thinking sandwiches again for lunch. What should I put you down for?
Oh, boundaries. They can be tough for young homeowners turning into their parents.
I'm either going to go tuna melt or Reuben.
Remember, when the door closes,
Oh, yes, gotcha. Okay. Looks like a super occasion.
Progressive can protect you from becoming your parents, but we can't protect all of them when you bundle with
I
us.
could go tuna melt. If you want to go Reuben, we could do a mix.
Smiling first can help someone find the courage to do the same.
We asked people who said they've had Domino's stuffed crust pizza before to compare it to our new stuffed crust.
This is our representative birthday.
But actually, we've had history with cheese.
Yeah, now the box to your left. That's the Domino's stuffed crust you said you've had before.
I'm confused. What's going on?
Domino's has never made a stuffed crust pizza before.
Are you serious?
It's Domino's first ever stuffed crust. Stuffed with melted cheese and topped with garlic seasoning and Parmesan.
Love it.
Give me one more if that's okay.
Try it for the first time tonight.
Dog made a bad.
There's a good way to handle it. Owner of Sons of Pets? There's a poop for that too. House on Pets? Co-host to go back and happiness. There's a poop for that. Washable? There's even a poop for that. See? There's a poop for every problem. Poop on Amazon. It's not poop, it's spit.
This isn't really something.
What's this?
I mean, discovering more of what we love for less just feels like something else, right?
Almost.
This isn't shopping. This is beyond shopping.
That's it?
This is finding.
Pros knows how to help you take clothes off with auto. That's why we carry GE Profile ultra-fast washer dryer combo. Powered with smooth testing, speeds wash and dry in about 2 hours. Shop great spot door deals at Lowe's. You know you save. Lowe's knows. Always first to pick up. Even if it's just a reflection. And you get same day delivery. We'll help you make sure everything's always out.
Awesome.
Lowe's knows how you serve.
You're not making sense.
I'm using an ultimatum here, so let me use that for you. Ultimatum is like home.
Stay here alone?
I'm pretty sure you're gonna move.
Do you even know what an ultimatum means? Do you know what that word means?
Yeah. I mean, it's kind of like an saying when you just wanna something to happen, like you support consequences if you don't. That's
So yeah, that's a very harsh word. So you're not gonna give me an ultimatum. If you give me an ultimatum, you're gonna get one right back.
We'll have this discussion later. It doesn't involve everybody right now. So let's just move on.
no, hold on a second.
Because we're here having a wonderful party at Lauren and Alex's new house. Let's just enjoy our time. Let me ask you something. Luke and I are friends, okay? We are very much we are. We're very much alike.
Do you know me?
You really want to be righteous so I can be born dead.
No, that's attack. I'm scared just like you are.
Previously on NCLEX.
I want you guys to have a really fun trip.
I believe that. My goodness.
Ireland, I'm confident that Katarina is gonna find the one.
I need someone that can change the light bulbs for me.
So you're not looking for a farmer, you're looking for an electrician.
It's gonna make it work.
I love you, Dawn. Tomorrow's your big day, you know? You're gonna have your birthday.
Oh my goodness.
But who's not gonna be the first one?
Monica is clearly crazy about Bruno,
And I want her to connect with a younger age so that she can compare. A good experience for you to practice. Have fun and ask questions.
okay, easy.
I can do it.
Easy. What do you wish to drink? A glass of juice? Yeah. Sweet right now.
Okay, okay.
Ellie wanted me to be virtually Harold 2.0 on this month. I want to be more smooth, more suave. But if I don't do it right, I'll fail miserably on my first date.
Who's watching your fur babies right now?
So I never know. I live with my parents.
Okay. I feel like Ethan is what I'm looking for, but he lives with his parents. Oh no.
So you always have a home video.
There's always an option home.
No.
Please make yourself comfortable over here. How are you feeling today, Nicole? I am good, thank you. It's a nice sunny weather, pretty unusual. I know, Ireland, so yeah.
I can run in Dublin yesterday, so I was able to like sleep a little bit and kind of rest up. I feel like it's been hard for me to express to Katarina exactly what I'm looking for. I feel like Katarina doesn't know me. I think that she like knows the Victoria that she wants me to be, but I think she definitely was judging me like the whole time yesterday.
Well, I mean, I don't really know how I feel about this yet. I'm just gonna trust the process and see how it goes. Now, what am I gonna set you up with first? I want to see the tomorrow. Did you bring it?
I brought it.
Can you try the clothes? Let's see. And
So what have
this
we
shoe
got
doesn't
here?
fit me.
A full head of hair.
It's up to you what you want to do. Not the black one. The yellow one I showed you. It's normal. Yes, I believe it. And check the shoe. If it doesn't fit you, then I'm gonna have to return it because sorry, it's too small. You cannot wear it without socks.
Hello, hello, hello. Can somebody say hi? Can you see my screen?
Hello, doctor.
Yes, ma'am.
Hello,
Hello, hello.
yes.
Welcome.
Hi,
Welcome.
doctor.
Hello. Good
Hi,
afternoon.
Can
doctor.
you see my screen? What do you see, ma'am?
Yes.
Question
Question
one.
601.
Question 601.
601.
Is it comfortable? Is it tight?
601.
Question
Okay, so we're going to start that.
601.
Okay, so take your pen and paper as usual. Our Sunday class is more of content that is just laid in question. A client is 36 hours post-op. Total knee replacement, TKR surgery. And the moment you see in the exam, if they are putting hours, there's a reason why they are putting that hours. Don't ignore it. They would have just said a client is post-op of TKR. They would have just said that. So we are going to put a lot of attention to details in the exam. Why are they using 2 hours? Why are they using 3 hours? You go back to that question. They really want me to bring something out of this. I would have just said a client is post-op, total knee replacement surgery, and I wouldn't make any attention to that. So because of that 36 hours, we are expecting anyone that goes for surgery. So not only in this kind of situation. The moment they say somebody goes for surgery, in the first 24 hours, the fluid that will be coming from the drainage system is going to be more. Anything like 400, 500, 600, like it's expected. But when they say more than 24 hours, we are expecting it to be reducing. So from TKR surgery, more than 24 hours, it should be less than 150. That's the rule. And in the first 24 hours, we can still expect 400, 500. So with this now, because of that hours, then what is the first thing to do? I'm going to notify the doctor as fast as possible. B say empty the drainage, C say do nothing, and D say remove the drain. So you can also guess, if I were to be the one to be given this question and I don't know what to do, I'm still going to pass it. I can guess that before you empty drainage, even if I'm going to empty drainage, I still have to notify the doctor. A smart person is going to be like that. So there's no question that is extremely bad in that exam. We just need more of your smartness about it. On no account can you say you're not going to do anything as a nurse. For a patient you have called, you actually want to do an implementation, you must act. So C can never be the answer. And before you remove any drainage as a nurse, a doctor must give the order for you to do the removal. So for me in the exam, if they give me a question like this, I have never heard of TKR surgery. I don't know the amount that I'm expecting in 24 hours and 36 hours, 48 hours. I'll just say, you know what? Let's make it make sense. If my content is not working, I will use my strategies. If my strategies are not working, I'll just look into the sky and call on to the person that created me. God, I need you to fix this situation for me. I'm going to start breaking it down the way I think it's supposed to be. Anything I'm going to pick, let it be worthy. And that is it. So with the way I've expressed it, a content person will pass it. A strategy person will also pass the same question. Never give up on any question. So that's the rule. A client is taking isoteriton, otherwise known as Accutane. We did it this past week in the class, and that's the reason why I brought these questions, because all of them are related to what we did this last week. Okay. We have a rule for isoteriton or Accutane. Who can tell us the principle? What documentation do they have to sign? He's going to try.
I pledge.
I pledge.
Okay, go ahead.
I pledge I won't be
Okay.
pregnant.
I pledge not to get
I
pregnant.
pledge form.
Oh, okay, and that's the word. I pledge that I will never get pregnant while I am on this medication. Just like we are pledging to the United States. So if you are taking isoteriton, so we are going to go through this I pledge program. So if you don't know it before, or maybe almost for anyone that is in this class, you must have known this at this level. If peradventure you have forgotten it, okay, just pick it up again. Any question related to vitamin A, isoteriton, Accutane, about several names that they give to it, you're going to know that this is vitamin A that they're talking about. They will have to sign this documentation, I pledge. They will give it to them, make a documentation, tell us you're not going to get pregnant. As simple as that. Another way they can hack it, they can say this person is 24-year-old female. At 24, it's expected that somebody should be pregnant. So they'll definitely make you know that the person is in the reproductive age. And the patient complain of maybe pimples, any of these sebum-related problem, and they have to give Accutane. And they say the person says, I had my menstruation 6 weeks ago. Every woman, almost 95 of us here, we are women. We're supposed to have our menstruation every 4 weeks. If you are having your own menstruation. You said the last time you menstruated was 6 weeks ago. Something is not right with you. The person must have been pregnant for 2 weeks. So what's the writing? She cannot continue with that medication. Number two. Another way they can have that so one single content, you can use it to do 50 questions. And that is why I'm more of a content person. I like people to do questions, but I like you to also know content. That single content, you can break down any kind of question. They say again that this person is going for this procedure or is taking this medication. What is the first thing to do? We are going to take their urine sample or their blood sample. You want to rule out HCG, human chorionic gonadotrophin. If they say there is a positive HCG in the urine and blood, automatically the person is pregnant. They don't have to use the word pregnancy. There are some statements that you will see in that question. They just want you to do critical thinking. If they say pregnancy, everybody will quickly pass that exam. So they will now make it a little bit tough. It's what you know. A patient says, or they say, did the blood sample, there's a positive HCG level, or there's a high HCG level, then that shows that this person is pregnant. They cannot take the Hakutin. And that's all about that. Bring your pen and paper anytime you are coming on Sunday. A nurse is working on outpatient health clinic. The patient say, I just tore my rotator cuff muscle. Who can tell us where we have the rotator cuff? When we say we have a problem with the rotator cuff, where do we have the rotator cuff? It's a very big English. On the shoulder. Perfect. Thank you, ma'am. On the shoulder. On the shoulder. Please look at your speaker. The moment you talk, try to, we'll just take you out of the class. I don't want us to stress ourselves today. If you are not talking, there's no reason why you have to unmute. But if we see you unmute yourself, we'll take you out of the class. So I don't keep repeating the same thing. So when they say rotator cuff, those are the muscles of the shoulder. I used to tell people anytime I'm teaching this, why can't they just tell us patient has a shoulder pain and all of us can be on the same page? They will say the patient has a rotator cuff injury. Oh my goodness. In the whole of my 18 years nursing, before I got to the United States, I have never heard of this word. So you can imagine if I say, oh, I'm a lecturer in nursing, I have had all this, and I now go and face NCLEX like that. I get to NCLEX exam, they now say, patient has rotator cuff injury. That will be a charade to my existence. I will say, what is all this with everything I have known in my lifetime? And that's why nobody will be too proud of saying, I know nursing until you get that license. You are still going to be acting as, I don't know, can you guys teach me? If they say shoulder pain, all of us will pass it. Now they will say rotator cuff injury is still injury to the shoulder, as simple as that. So if you don't know before, please write it down in your journal. Rotator cuff injury is a shoulder-related problem. Okay. We now want to do anatomy or medical surgical of it. So where is it coming from? What muscles are injured? Teres minor, infraspinatus, and supraspinatus. Those are the three muscles that make up the rotator cuff injury. Those are the ones that are actually destroyed. And that's it. So if they bring it as select order applied, you just pick what you know, but if you know it, just pick all of them. So they said, which of the following muscle cannot be considered? Which one is not part of the problem? It is a teres major. It's not part of it. It's only the minor, the supra, and the infra. A patient has been prescribed Novax. Who can tell us the trade name or the other name for Novax? Novax is the trade name. What is the chemical constituent or the generic name? Who's going to guess?
Amlodipine.
Amlodipine. Can somebody write it down, please? Please write it down. Amlodipine. So for me, I like them if they give me the generic name. It's going to be easy for you to do a test-taking strategy. If they don't give generic name, it's going to be hard. But these days, they've been nice. They've been giving the two together. They will put Novak, they will now put amlodipine in the bracket. So in that case, that's a good one. unless they want to be bad, which is going to be 1 or 2. They just, okay, this is your 85 question. Let's see how you can figure this out. You've been passing. They now bring Novask. That's bad because that's a trade name. Anybody can name anything trade name. So it might not be easy for you to make it to do a what is right. But now, if I see a depin, all of us know that if it is ending with DIPIN, it is a medication for blood pressure. Blood pressure. Please check your pharmacology synopsis. We have created new pharmacology synopsis, all of them. There's new 7 ones. Check it again. Blood pressure. So look at it. So what is it going to be for? As long as you know that it is a depin, it's going to take care of this. So which of the side effects should the patient specifically watch for? Since we are using the medication to treat hypertension, then it's going to cause hypotension as a side effect. As simple as that. So this is easier. Most pharmacology question, you can still guess and pass the question. The client described their family has been having a multiple wives. All of them are sisters, married to one man. The nurse document the family structure has. All these are management questions. I guess it has come to stay now. Some people will tell you they have 15 management questions. That is too much. Why do I say it? And that's why we have to be more prayerful. Management questions are very boring. They don't really have a live content like that. Even if in Sanders, how many pages did they use for management? Only 3 pages. Only 3 pages because it doesn't have a kind of weighty, a kind of content that is very complex. So they bring it from different unnecessary things, ambulatory things that is all around. 2 nurses are fighting on the floor. You are the charge nurse on that day. How do you manage the situation? They will say, can you float one to this place? So you just figure it out on that spot most of the time. So this one, the answer is Aurora. So we'll just make it easy. The moment anybody unmute themselves, I'll take you out of the class. That'll be the best thing for us to do it. So we don't keep repeating the same thing. If you unmute yourself and you are not ready to talk, we'll just take you out of the class. So let's make it a rule. If you are not talking at all, just mute yourself. If you want to ask questions, then unmute. I don't want to force mute everyone so that if you have to ask questions, it's going to be easier. So sorrow now. One man is having many is getting married to sisters of the same mother. Which type of dressing is recommended to place to a site where a chest tube is removed by the physician? This is extreme high yield in the exam. When I say extreme, I mean extreme. They ask it in different ways. Your answer will always be that petrolatum. Why are we putting a chest tube? I can guess also in the exam. If I don't know it, I can also guess. The aim of our Sunday class is for us not to give up on any question. We are bossing up our game of answering questions. You may cram the whole of Sanders. If your techniques of answering question is poor, the person is still not going to be a passer of NCLEX. Already, I can look at it this way. If you know the content, the answer is petrolatum. Now I don't know it, and I still want to pass it. I'll go back to the word chest tube. Why do we create a chest tube? A patient has a lung problem, maybe a lung cancer. They have to do a lung surgery or a lung recession. Something was done in the lungs, and we have to take out the water, the blood, or the post-surgical fluid, they are going to put the patient on a chest tube. Now I'm going very elementary. That's how I'm going to be operating in the exam. What am I trying to do? I am changing their English to my own dialect. I'm picturing it out to make life easy for me. This patient has a lung problem and they put a chest tube. If they put a chest tube, they would have created a hole. You see the way I'm talking to myself, I won't fail a question like this. There's no way I'll fail it. Why? I'm not giving room for devil or any kind of distraction to overwhelm my thoughts. Yeah, I'm just doing the right thing. Okay, if they create a chest tube and they have removed the tube, that means there's going to be a hole there. So if there's a hole, If I put a transparent dressing in a hole, here we go inside. Patient will have embolism. I take it out. Now I don't know content. For me, I don't know content. And right now, I want to pass NCLEX. I still don't want to give up on myself. Okay, colloidal dressing. Maybe because I've heard of the word colloid. All these are treatment dressing. Treatment. They have already put some colloid. Wound that is not healing. All those stage 4, stage 5 wound. If you have tried everything in this world, doctor will say, okay, let's try colloidal. They are for treatment. This is not an infected wound. This is not an infected wound. It is a hole that was created for us to put a tube inside. So there's no point using a colloid because it is not an infected wound. I will take it out. Petrolatum. I'm not sure whether that is the answer or not. I will still hold on to that. I will now go and check number D, non-adherent dressing. If it is non-adherent, if I put it on the hole, it will drop. It will drop. And here we enter. Automatically, letter A, letter B, letter D is not the answer because I've done elimination. Whether C is now the answer or not, I don't know. I don't care. That is the only thing that is left. I can't be struggling further. I have been able to do elimination. I'll just take C and I'll say, God, I'm taking C. I have ruled out A, B, D. I don't think they're going to be the answer. Let's take the lead. And that settles it. But for the one that knows content, that is what we use, basically, petrolatum. If you have forgotten the content, because the content to be candid, it is extremely complex. There's a room for one or two reasons why you're going to forget one or two of them. But nevertheless, don't say, I have the right to fail 15. You don't know whether you have even failed 15 earlier. You are not sure. So don't keep saying, well, I still have the right to fail 15. I can fail this one. If somebody begin to do that, someone might fail almost 30 questions, and it's not going to be easy to pass. The nurse is supporting a family who has just experienced a sudden and unexpected death. So what does she need to know? That the survivor had greater emotional turmoil. They have a shock than when death is expected. So this is also gonna be something like management. You just have to figure it out. A will be the best answer in this situation. All of that looks good, but A is the best expression. Which direction given to the nursing assistant is most likely to accomplish the task of getting the urine specimen delivered to the lab immediately after collection? Which direction are you going to give to her? I guess D is the best expression. D is the best. Takes this client to the bathroom now, collect the urine specimen, take the specimen to the lab immediately. And as a matter of fact, you can also be smart. Any word in the exam that is more complex, it has a lot of story in the option, and not all other ones look scanty. Maybe that is your answer. Another test taking strategy. Maybe that is your answer. But make sure you read everything and it makes sense, because it can be very wordy and all the words might be nonsense. So as long as you read it, why is it that D is the one that is having a lot of statement more than the other ones? When planning intervention for a client during crisis, should the following outcome is most appropriate? This is more of mental health. In crisis intervention, what is the best? Can you make use of your coping mechanism? The way I can cope is different from how other people can cope. Everybody has different coping mechanisms. Some people can only do 2 days job. They have to rest. All of us have different coping mechanisms. Some of us, we can do 7 days and nothing will happen to us. We still continue. So, and that's why we have to accommodate people based on how they can cope with issues. The nurse working with elder clients should keep in mind that falls are most likely to what? To happen to elderly who are what? Are they those ones in their homes? Are they those ones in the 80s? In their 80s? Are they those ones living on social security only? And the first thing I'm going to take out is this one. This is a Naomi. And we have said, Naomi, we don't need it at all. 95% of Naomi is not needed in the exam. Naomi, we don't like it. If you take Naomi, it may not be the best for you in the exam. So anytime you see anything Naomi, avoid them in the exam. They may not likely 95% be your answer. Can somebody remind us the meaning of Naomi? When you see those words, avoid them. Naomi, already. Who's going to try? Remind us of the meaning of Naomi.
Never.
Okay,
Always.
never. Okay,
Only.
hold on. Let's be writing it down. Never. Next one is none. N raised to power 2. Never none. Okay. A is what?
Always. Always.
Always. Okay. And all. A raised to power 2. Our O is what?
Only.
Often and only.
Only.
Often and only. Our M is what?
Must.
Many
Most.
and most. Many and most.
The
Many and
ever.
most. And our E is what? Every.
Every.
Every. So that is Naomi. You can quickly write it down if you have forgotten it. So most often when we have questions or options that are connected with Naomi, 95% they may never be our answer. But we have some 5% that can be Naomi that will still be our answer. In the 50 states of the United States, every children must be ruled out to do a PKU, phenylketonuria test. So in that case, that is Naomi, but it's the right statement. Is the right statement. So 5% you will know that it is Naomi, but it will still be your answer. Let's move on. 14-year-old boy has been admitted to a mental health unit for observation. The boy becomes agitated and started yelling. What should the nurse first response be? What will our first response be? Just create an atmosphere of seclusion for the boy and procedure. So just an atmosphere where they can just stay alone and just de-escalate themselves because they're agitated. All other ones looks good. We can never even say, see, what is making you mad? That word mad. If any nurse try to mistakenly say that in the side hospital, most people, they always think, you think they are mad. They are not really mad though. All of them are coming to psych because of what? Because they don't have home. A lot of them are homeless. And that's why you see during that winter period, we have a lot of admission. All of them, they don't have anywhere to stay. So they just say, I want to kill myself. They are bringing them to the hospital. So some are not even mad. Of recent, I saw one like about 2-3 weeks ago. She said, I've been trying to apply for Section 8 and they did not give me, they didn't put me on the list. A friend told me that I should try to attempt suicide. If I try to attempt suicide, if the doctor make a diagnosis of MDD with psychosis, that is enough to be given a Section 8 application for free house. You can see how people are beating the system. And we are the one doing the work. They're taking all our money for tasks. We are paying a lot of money to Uncle Sam. And some people are getting all the dividend of our work. You can imagine. I got to her, I said, you don't look as a psych patient. She was calm, well-groomed. What is going on? She took 41 pieces of Tylenol and took about 35 pieces of aspirin. The moment she put it in her mouth, she called her daughter. She said, can you call 911? That means you don't want to die. You really don't want to die. If you really want to die, you should have accepted those medications to be well metabolized, and that's all. You understand? She called immediately. They quickly took her to the ER and they do gastric lavage. They quickly took it out. And the next, they stabilize her in the medical unit. They transfer to the side. And you just have to say, the patient has MDD. So please, if you are just coming in and if you are not muting yourself, we'll take you out of the class. So you're just going to say, oh, this patient has MDD. I guess the person has refused to take herself to do that. Yes, take her out of the class. And the next diagnosis was MDD. And she said, that is enough. When I get out of the hospital, once they see in my record that I have that particular condition, they're going to approve me. So if you now say to a patient like that, you say number C, oh, are you mad? The word mad is even sarcastic. They don't want to use the word mad. And that's why they say, oh, they are mentally challenged. They don't even want us to say they are mentally ill. So that is that some words you don't want to say, it is going to count against us. And the word why, we actually want to avoid WYHY in psychiatry. We don't ask why in psychiatry, why? And the reason why is that There's no solution to mental illness. So why are you asking me? Can you tell me why you are mentally ill? Oh, are you kidding me? I don't know how my dopamine came high. So I don't have answer to your why. So in psychiatry, avoid the word why in the exam most of the time, unless the why is connected to something that you think is the best among that option, and the other three are not right. That's the only time you're going to pick why. But almost 99% of our question, that is why, they may likely not be the answer. So look at that, and you can also be using strategy to pass those questions. The nurse noticed that the family is waiting at the nurse's station for his loved one to be brought to the unit. During change of shift, the nurse should do what? Request that the family wait for the loved one in the client's room, wait to resume the report until the family has left the desk area. But you don't want to start expressing the patient report while the family are there. So let them leave before you do that, and that is IPA, for the sake of IPA. So this is also like a management questions. They will give you 4 options, something like a story, a scenario. You figure it out and pick the right answer. A client report that someone is in the room and is trying to kill him. The nurse's best response is to do what? I don't see anyone. The first thing is to what? Present them reality. I know you are mentally challenged, fine. But for me, I really don't see anyone. That is presentation of reality. That's the first thing. But you seems to be very frightened. That's one. Another one, they can say, you seem to be very frightened. That is, you are acknowledging the feeling. It can come in any way. Acknowledge feelings, present reality. That is number B. That is our statement, our treatment for delusion and hallucination. You can write it down. You acknowledge the feelings and you present them with reality. Or you can present with reality and acknowledge feeling. You can do it in any way. So this way now, I present with reality and I acknowledge feelings. You can see another question, another option. Present with, acknowledge their feeling. That must be devastating. That must be very enticing. That must be stuff like that. You're acknowledging that I know that you have the problem, but I don't see what you see. Another one can say that, can we go there? You acknowledge the feelings. You will now tell the patient, let's go to your room together to look for that person that wants to kill you. In that case, also, you are still presenting reality. So when you get to the room, you now say, I can't see anybody that wants to kill you. And the patient can now be calm with that. 22-year-old patient in a mental health lockdown unit under suicide watch appears happy about being discharged. Which of the following is probably happening? I'm happy. I want to go home. We know that in antidepressant, it doesn't work like immediately. It doesn't work immediately. It takes about 2 to 4 weeks before antidepressant kicks in. We know that. So that time when they are happy, maybe that is when they want to commit the suicide. That's when they have the energy. The patient's suicide plan has probably progressed. He's happy, I'm going on. It's too much, too much, too much. What is going on? What is going on? This patient was actually what, in a mental health lockdown unit under suicide watch. So he was actually having what, a active suicide plan. Now we say we are going to discharge you. He's extremely happy suddenly. Maybe. So it is that time when they have that increased energy, that is when they are likely going to commit suicide. It looks awkward, but that's the answer. The nurse is assessing 18-year-old female who has traumatic brain injury. The nurse notes his slower pulse and impaired respiratory. The nurse should report those findings immediately. And that is the finding of what? Intracranial pressure. So what is the opposite of intracranial pressure? What condition is the opposite of intracranial pressure? Who can guess?
Shock.
Shock. Thank you. Good job. So we just always, at every point in time, we say shock and we say ICP, increase ICP. Who can tell us the signs of shock? The moment you know the signs of shock, just opposite it to give you the signs of ICP.
Low
If you
blood
know the
pressure.
signs of ICP, okay, go ahead. Low blood pressure.
Increased
Okay.
pulse.
It's called tachycardia.
High pulse and what? And what?
High
Tachycardia.
respiration.
High
Increased
respiratory. Okay.
respiration. Yeah.
Yes.
Okay. So now, if you know this now, even if you have not known this, the moment you cram shock, just opposite it. So what do we see in ICP?
High blood pressure.
Increased blood pressure. Vomiting.
Okay.
Tachycardia.
Low
Low
pulse.
respiratory.
Low pulse, low
Somebody are
respiratory.
not, some people are not here. They are just talking. Somebody say
Yeah.
tachycardia. It can never be.
Bradycardia.
Yeah.
Tachycardia.
Yeah. So please, so be intentional with NCLEX. So you know why a lot of us are struggling? It's because all of us are putting our female personality to professionalism. You have to be dogged. You have to be a lion to achieve anything in life. You must be a lion. People must call you crazy. The moment, if people have not called you crazy, then maybe that thing that you are doing is not well done. Until people say this person is crazy, and then that means you are doing well. You have to be intentional with everything you do. They are going to say, are you crazy? Why will you be reading for 8 hours and 24 hours? When I did my own management board exam, you said management, right? Management board exam. You want to equate it with life-related board exam. If I mistakenly give insulin, the patient will die. If you mistakenly write $2,000 for a patient, a client that comes to your counter, and you're supposed to write 200, you guys can still control it, right? You will just block the patient, that client's account. She won't be able to remove the money, right? So don't connect your own with me. Some people will tell you, nurses are doing too much. What's the big deal about the exam? It is really a big deal. Why? Because you're going to deal with life. That person that is telling you is not a big deal. He did management course. She can relax with her own study and her own board exam, not our own, no. Nursing, medicine, and bar exam, law. People that have done the research, they have said those 3 board exam is the most craziest in the United States. They are not lying because you don't have to be gentle about it. You go for it, you achieve it. So if you are talking about content, when we say low blood pressure, we mean it. When we say high blood pressure, we mean it. Don't be giving low for high to be on the safe side. So you can write it down like this. So if you are done writing it, I can clean it and we can move further. 55-year-old female asking us the following. Which minerals is the most important to prevent osteoporosis? Everybody knows it's calcium. Now, if I add to this question and I say that, which vitamins will aid calcium absorption? And I'll put vitamin A, vitamin D, vitamin E, vitamin K. Who is going to tell us the answer?
Vitamin D.
Vitamin D. Okay, so we all understand. Vitamin D aid calcium absorption, and that is that. So if peradventure they don't give you calcium, they now say the patient has osteoporosis, they now bring it in form of vitamins. Which vitamin deficiency does the patient have? A, D, E, K. What's your answer?
E.
What's the answer?
Deficiency.
Which vitamin? Is
Vitamin
still
D.
D.
Is D.
I just
It's
increase the
vitamin
volume of
D.
the question. It's still what you know. That's how the exam operates. Most of those things we know it, but a lot of us has crammed something from home, from Sanders or from the content. When they now change the game on us, they get scattered. And that's why your critical thinking concept has to be on the high side. It's not going to be like easy way, the way we are saying it. Now I change it, I make it more tighter. It's still the same concept or the same content that you know. You just have to go by that changes as fast as possible. A nurse is caring for a patient. This which type of cells secrete exocrine secretions that makes an exocrine secretion? Basically, it's all the Hasina cells. For all of us, if you do anatomy, basically in our first 3 months, these are always the questions in most of the questions. A patient has been placed on retroviral. As long as it is ending with VIR, it is antiviral medication. Any medication that you have the word VIR in it, it is for virus. So that's a giveaway for any student. We have many of them that is VIR. That's a giveaway. So what am I going to be watching out for as the side effect? So patient is going to have what? You say this patient has a fever and the patient has an anemia. So most often it's going to be destroying the white blood cell and they're going to be exposed to opportunistic infection as fast as possible. And it's also break down their red blood cells. And that's why you see HIV patient, they look so lean because it destroys the red blood cell also. But for me, it's administered to type 2 diabetes mellitus. We did it last week. It's the most popular medication for type 2 diabetes mellitus. What are we using it for? This one also you can guess. They have said type 2 diabetes mellitus. And in diabetes mellitus, our number one signs and symptoms is hyperglycemia. The glucose is high. As simple as that. We are only saying diabetes mellitus. If you want to go by the English, what is the meaning of diabetes mellitus? Patient has a high glucose. The medical name is diabetes mellitus. The English name is what? A high glucose. As simple as that. So I will give this medication to lower the glucose. We cannot, the answer cannot be a hypoglycemic agent. We cannot use that. And insulin analog, we cannot use that. And A is just the best answer. A nurse is working in the PAID unit. 25-year-old mother comes in with a 4-week-old baby. The mother is in distress. She says the baby has an abdominal colic. Which of the following techniques should the nurse teach the mother? Please look at your speaker. If you continue to unmute yourself, I'll take you out of the class. Ready? So what's the best? A neural warm technique. You just wrap up the baby. Just like what we do for a baby that has ASD, all those alcohols or alcohol syndrome, withdrawal syndrome. You just wrap them up to relieve their startling. And they say the baby has a colicky problem, something abdominal, so they don't see the baby is going to be restless. So D will be the best for the baby. A 55-year-old man suffered the problem of the frontal lobe. The patient family is not present, and which of the following should a nurse watch out for? So the lobes, I guess we all have to know what is going on in the frontal lobe. The cerebrum, the moment we have the cerebrum, we have the frontal lobe, we have the parietal, we have the tempora, and this is the only way they ask the question, and we have the occiput. So in the frontal lobe, we just say the frontal lobe is needed for what? For emotion, is the one for behavior, is the one that can make us to read and not forget for many years, is needed for our cognition. It is needed for executive function. What you can do as an executive is the one organizing all the meetings in the hospital or all the meetings in that organization. Executive function, that is for frontal lobe. And that is the reason why when a patient has a schizophrenia, we will say they have a problem with their frontal lobe. Everything will be disorganized. That is that. You can tell us the function of the parietal. The parietal lobe, what is it coordinating? Our parietal is on the two sides, somewhere around in the head. No, occiput is for that.
Perception.
Thank you for perception and sensation. So if somebody slapped me from my back right now, I can look back and slap the person back, right? Because I'm able to perceive that, oh, this is an enemy, something is not right. If peradventure somebody use a needle to pinch my skin and I quickly take my hand up, it is parietal lobe that is making me to perceive sensations. Is for perception and for sensation. So it makes you to know whether there is high temperature, whether there is a pain, whether there is a pressure. It is that lobe that promotes that. Temporal. Who will tell us the function of temporal? What are we using temporal for? If peradventure I
Balance
change
and
this question
hearing.
now.
For hearing.
Balance hearing. So if I change this question now to temporal, if I change this to temporal, your answer will be for hearing already. So now, if I change this question now to occiput, occipital, what will be our answer? This
Vision.
is not there.
Vision.
It's going to be for vision. Vision. It's going to be for vision. So now, let's now clear this up. Because if you are going to write, please quickly write. Frontal lobe is for the emotion and behavior. Parietal is for perception. You'll be able to know whether there's high temperature, a pain, and a pressure. Temporal is for hearing, and occiput is for vision. So now, this same question, they say observe appetite and vision deficit. So in the exam, we have some options that will look, one aspect of it will be nice, will be your right answer. The other aspect is not going to be right. They can now bring an options that say it takes care of the patient vision and eye problem. That will be your answer. This one looks like good. The beginning is bad. The tail end is good. So that we are not going to take it if they are asking it for occiput. Or it's going to just be for our vision alone. So there are some questions that they're going to make sure that they make it comma, comma, anything that has an injunction. An injunction means when it's having with and comma. So make sure you check what is in front of that injunction, something like this, and check what is at the back. They put something in the front and they put and. This one comes like this, a comma and like this. I'm going to be careful in the exam. The exam is not that bad. We all just have to be very, very what? We don't want to lose our guard. If the beginning is good, is the end of expression good, then that is when I'm going to pick it. The beginning might be good, the end might be bad. It is not my answer. The beginning might be bad, the end might be good. It is still not my answer. What am I looking for in a comma, comma question or any comma, comma or any kind of injunction option? I will make sure that the beginning and the end is good. So it's also a trick in that exam. So that's why we say that people that pass that exam are not really the intelligent ones. It is a smart student that is calm. You are going to have extreme patience. If you are the type that is not patient before, any little thing, you are always very restless. It cannot work with NCLEX. You are going to pray for spirit of patience. God, help me. Let me be able to read him one and one by the other. That is it. Some of us that are very kind of, oh, I just want to quickly do these things. No, we are going to be calm about it to make it easy. Patient has recently taken albuterol. Almost every patient, every student going for which of the following changes are not associated. That if you are going for the exam, you must know that albuterol is coming from the group, is a family of LOL, atenolol, propanolol. So most side effect that those ones are causing will also be the side effect of this. And that's why we say that a patient that is taking that is asthmatic, we don't give them the LOL because they are going to be on this group of people, ROL. If you give them LOL, it will shut down their blood pressure, even though they don't have what? A blood pressure problem. Because the patient is asthmatic, they cannot take ROL like that. So ROL generally will make the blood pressure to go high. Sorry, I wanted to say hypertension. It will make the blood pressure to go high. The patient will have tachycardia and they will actually have a bronchodilator. So the good reason why we are using albuterol is to do a bronchodilation. That's the good aspect of it. The bad aspect of it is it causes tachycardia and it causes hypertension. It makes their blood pressure to go crazy. I'm repeating it again. Albuterol will increase the blood pressure, hypertension. It will also increase the pulse, tachycardia, to increase, to increase. And the only good thing is that it causes bronchodilation. And the last thing it doesn't cause is sensory changes. It doesn't cause that. And the question say not associated. Another thing we are going to be training ourselves for in the exam. A lot of us go to the exam expecting a positive questions. Some of the question, well over 15% of your questions will be negative. When we mean negative, they're going to be saying except, not. Which of these is this, except they know that a lot of us have, the moment we are reading in that positive format. At the tail end of the question, they have said except. When they say except, you just have to also roll like that. You just have to change by that. So when they say not, still the same thing for except. It started as positive. At the tail end of the question, they change it to negative. Many people cram the positive for that 2 minutes and they forget that, fine, they read that not, they read the except, but they are wired with what? All the questions they have been doing before the exam have always been positive questions. So they have never been exposed to the fact that they can change it and say except. So when they say except, you also go by the except. If they say not, you go by the not. So that's the game of the questions. A PN is caring for a client with D insipidus, which the nurse can expect the lab work to show. What are we expecting her to have? We did this last week in diabetes insipidus, and I've said the only two things you need to know is that you must not forget what is going on with their urine and what is going on with their blood. So with the urine, we say urine specific gravity. With the blood, we say serum osmolarity. So who can tell us what is going on in the urine of DI and what is going on in the blood of DI? Just gonna try. Have
Can I
many
try,
people.
doctor?
Go ahead, ma'am. Miss Kemi.
Oh, for the DI urine is increasing.
Okay, we have
Like for the
high urine specific gravity already. So then the blood, is that what you have?
osmolarity will decrease here. We have low.
A low blood osmolarity, a low serum osmolarity. Hey, good job. So if we have known this, it should be easy for us then. So if you know that, then I'll say, a client with diabetes insipidus, what are we expecting in the urine of the individual? So what answer are we picking?
I think the specific gravity will reduce.
Want us to be on the same page?
Okay.
I really want to bring out something from here because I know that I would not want to know it today.
The
Hello,
urine
ma.
specific is supposed to be low.
Because of accept.
Okay. PN is caring for a client with diabetes insipidus. And thank you for that person that said the nurse can expect the lab work to show what. This one is expect, not accept. What are we expecting? That's it. What are we expecting? The right thing that we are expecting. Okay, so let's see who can the urine. What will happen to the urine without using that big word? What will happen to the urine of a DI patient? How will their urine look like?
Diluted.
Diluted and large.
It will be diluted. It will be diluted. So when it is diluted, what we have, what do we call a diluted urine?
Urine. Is it not like
In physiological.
low specific gravity?
Low specific gravity. So, and that's why I took my time. She has already said her own. I was expecting somebody to debunk, but that's why I took my time. A low urine specific gravity. What will happen to the blood? Let's first of all start with the English. How will the blood be
Concentrated.
concentrated? The blood will be
The blood will be
concentrated.
concentrated.
What English do we call a concentrated blood?
High
Osmolarity.
High serum osmolarity.
Osmolarity.
So what is our answer? Our answer is D. If you have not gotten to this level for acute content, you still have to study more. You still have to study more. Already. Let's switch to diabetes. The opposite one. What is the opposite of DI? Which condition is opposite of DI?
SIDH.
SIADH.
Yeah, I call it.
SIDAT. Some people will say Said. Hey, already. So for Said or Saidat, what happens to the blood of Said? SID.
Diluted.
Diluted. Diluted
Okay,
watery. Diluted.
Blood of Said is diluted. When it is diluted, what do we call it?
Increased serum osmolarity. Low serum
It's going to be low serum osmolarity. Okay.
Much better now.
Already, it's making sense now. What happens to urine of Said?
Concentrated.
It's concentrated. So always start with the elementary. The moment you start with your elementary, don't say, I don't know English, or I don't know how to speak English. Nobody cares about your English in NCLEX. Just come and pass and bring the license. So you just say, the urine is concentrated. If the urine is concentrated, okay, let's now go for NCLEX statement, their own big English. That is high urine specific gravity.
Specific gravity.
So that's how I'm going to be operating in the exam. Let them say, I don't know how to speak English. I don't care. Even when I'm reading at home, I'm going to be doing that way. It is possible for me to put my language in front of that thing I'm writing in my jotter. I will do that. Oh. For me, I will do that. Okay, when the urine is low, this is the meaning. This one, when it's dehydrated, I will just write it in my own dialect to make life easy for me, and I won't have to forget it. And that is all about that. It looks concentrated, but it is what I'm expecting all of us to know. Please mute your speaker. Look at yourself and mute your speaker. The nurse is teaching the client about communicable disease and explains that the portal entry is what? And explains that the portal entry is what? Is it a vector? It is a source? It is a food? It's just a system. So a path through which something is going to enter. That is the portal entry. So D will be the best for this. After securing the client safety from a faulty electric bed, the nurse should take which action? Patient, it is our own, we are the one that caused it. The bed got faulty. So that is a problem with the patient gadgets. What's the next thing you're going to do? Quickly write an incident report. In case patient is going to wake up tomorrow and say, oh, because of the electric bed that was faulty, I have anemia. You guys has already suckled my blood with this. So at least I will quickly write an incident report to back myself up, because it is a sentinel effect. I was never planning it. A token economy is a type of therapy that focuses on does anybody understand what is token economy? It is used in psychiatry.
You give reward.
Reward,
It's
like
a reward, yeah.
Reward for good.
Yeah, for
Yeah.
good deed.
Yeah, for good days. Yeah. So for anything good a patient has done, you just give them a token. A token, anything. It could be money, it could be anything. That if you guys wake up as early as 9, you take your bath, you come for group therapy when I'm expecting you to come for it, then I'll make sure I double your snacks today. So it's a behavioral modification techniques. So once they have it in mind that if we wake up without being prompted, we take our bath, nobody is forcing us to take our bath, we go for group therapy as early as possible, they're going to give me 2 snacks. So you will see them, they'll quickly do everything that you want them to do. That is behavioral modification. And so they keep doing that every day, and it becomes part and parcel of them. So that is token economy. A client hacks a nurse working on the dental office, that's which anesthetic agents is the doctor using. So they always use laughing gas, and our laughing gas is nitrous oxide. You can also guess in the exam, nitrogen, nitric, nitrogen dioxide. I can take out the ones that is nitrogen. Nitrogen are similar in the exam. It can never be the answer. I can take that out. I'm now left with what? Nitrous oxide, nitric oxide. We have never heard of the word nitric oxide in the whole of nursing. So you can still guess. Nitrous oxide, if you are more used to nursing content, we always say laughing gas, laughing gas, laughing gas. That is nitrous oxide. You will still guess and pass it. Don't give up on any question. Even if you have not known it before, try to use a test-taking strategy and always have it in your mind. We die here. We are going to have what? A positive death. And what is that? It will look as if you're going to die. But the moment you see the license in front of you, you just say, this thing almost killed me. But thank God my license is here. You will be smiling. That's a positive death. So never give up on any question. What is the information? How is the information documented on incident report? How do we use it? We use it for all of the above. Another giveaway. Almost 85% of options that has the word all of the above, that all of the above is your answer. I didn't say 100% though. Almost 85%. That is if you know you have read it, you don't know. That is when we use test-taking strategy. We don't quickly use test-taking strategy immediately. That's a lazy method of doing question. Try as much as possible to use your content. Now, when your content fails you, that is when you say, okay, I will not just pick any answer because I don't want to fail it. Let's try to use test-taking strategy, and I hope that is going to work. You can use that. If I have read A, B, C, if the three of them does not make any sense to me, I don't know it, and I see all of the above as number D, I'll pick it. That'll be my answer, and I'll move on. Almost 85% you are going to be right, most often. So that's a giveaway. While repositioning a comatose client, the nurse senses a tingling sensation as she lowers the bed. What action should she take? Unplug. Unplug is going to damage as fast as possible the bed source. If she notices a tingling sensation, that means she's also shocking. Something is not right with her. We have said man before machine, machine before man, most often. So what's the point? Are you going to take care of the patient? We have M and M phenomenon. And we're going to be careful about this. Many of our questions, we are going to take care of the man, which is the patient, before machine. Right? But there are some of our questions that we are going to take care of the machine before man. If not, you are going to get electrocuted. You ignore the patient in the question, you go and take care of that machine. And that's why we are picking A. Now we are doing machine before man. What's an example of man before machine? The patient has a chest tube. The chest tube has dropped on the bed of the patient. Patient has shortness of breath. What's the first thing to do? Slam the patient on oxygen. In that case, you're going to do man before machine. So this one is not about content. It's now test-taking strategy. I will do man before machine because that one that is on the floor, patient has shortness of breath and the chest tube has already dropped on the bed of the patient. I can quickly take care of the patient, give oxygen, and come and take care of the tube later. But in this situation, I'm taking care of the patient. I am here, I'm having a tingling sensation. Something is going to be, me too, I'm going to get electrocuted if care is not taken. I will now do machine before man. Of the source, then we can now take care of the next thing. Take care of yourself first because you also have family at home. That's the meaning. So nurses are also being taken care of. A paraplegic patient is in the hospital. He's being treated for electrolyte imbalance. Which level of care is this? I deliberately bring this. We don't have the level of care in Sanders, but we have the level of care in the exam. And we just want to tackle it as fast as possible. And that's why try as much as possible to be in class on Sunday, unless I have an emergency or unless we just want to rest for 2 weeks or 3 weeks before we have the next class. That's when we stop our Sunday class. So it's always ongoing. If you have the time, come. Those things that we don't get in Sanders or all other things that is ambulatory, you understand what I mean? I don't know who is here. When I say ambulatory, all of us are understanding. You understand what I mean by that? So we are going to deal with primary, secondary, and tertiary. Primary, secondary, and tertiary. When we say primary level of prevention, who can guess? What are we looking for in primary level of prevention? Let's see whether we have to. Go
I
ahead,
think
sir.
before the
Prevention.
education,
Of them are
Yes.
prevention.
Prevention.
Okay.
education, immunization.
Okay.
Okay. In primary level of prevention, the activities that we have to do to prevent the patient from having the problem, things that we have to do. There's no problem at all. Patient has not had any infection. There is no medical surgical condition. So you are going to look at it and decide which one is primary, secondary, and tertiary. So look at the question they are asking you. From the question now, I will now decide on what to do. Patient is being treated for electrolyte imbalance. If there's an electrolyte imbalance, that means there's already whether hypokalemia, so there's a diagnosis. So in primary level of prevention, let's start primary. There was no problem at all. Activities that will prevent the patient from not having any medical surgical condition. And people have just said it. Anything that has to do with screening, examination, health education, immunization, vaccination. Yeah, so you can just write it down. You have just expressed it. All those are primary prevention. It has not happened. What do we have to do for it not to happen? That is primary level of prevention. In secondary level of prevention, that thing has happened. What we want to do is early identification and prompt treatment. Early identification and prompt treatment. So when they say a patient is being treated, it is secondary. This is just what you need. The what? That is secondary. I won't even stress myself so much in a question like this. Some of us are very smart. Smart in that you don't have to know too much. And that's why you see those our young children, all the school of nursing that I'm teaching, once they finish the 2 years course, if we present 90 students, almost 89 of them will pass. They are less than 22 years old. All of them are passing like crazily. Why? They were groomed in the United States. They were born here. They understand the lyrics. They have been exposed to all these objective method of studying from their elementary school. So they know what they are looking for in all the contents. They know content and they will use strategy. Only 50% content, the remaining they use strategy to pass the exam. They know the words they are looking for. Once they say that this is the answer, and they will, and by the time you are still struggling, that according to WHO, they will say, no, we're not doing WHO health. The treated, that word treated is enough for us to pass it. You say, how are these children knowing this thing? Where are they getting this thing from? But we, where we came from, they stress us to be cramming, cramming, cramming. We now find ourselves in a situation where cramming does not really work like that. You just have to be more smart about stuffs that you do. That's that. Already. So tertiary. In tertiary level of development, the problem has already gone moribund. There is a bad situation. We now want to do a rehabilitation so they can come back to life. So they can say a patient has schizophrenia. He's now coming for a follow-up care. It's a moribund case already. There's no solution to schizophrenia. If he's coming for follow-up, that is tertiary. A patient has a depression, is coming for follow-up care, that is tertiary. There's no solution to MDD. We can still manage normal depression. The moment they say major depressive disorder, that's the end. That's the end. The person will continue to take medication forever. It becomes second, it's become tertiary. So if you look at that situation, if it is bad already and they are doing a rehabilitation, that is tertiary. If it has not happened at all and we want to prevent it from happening, that is primary. If we have the problem, we quickly want to identify and find a solution and treat it, that is secondary. So we just have to know that. Patient is listed for S category. The moment it's S category, she must use a reliable form of birth control. Any medication that we say it is category X, they will destroy the baby most often. So make sure we don't really want to use it for pregnant mothers. A 27-year-old woman has delivered twins in the hobby. The patient developed a condition of 5 centimeter rectus abdominis. Can somebody tell us another name that we call rectus abdominis? We've said it before in the class and we are bringing it again. That thing, that if that woman is sick,
abdominal nozzles.
okay, already, if that there's this condition that they say when they are obese and they go for a major surgery, after 3 or 4 days, the wound is going to be gaping and the intestine will come out. Who can tell us the name? The two names, the two of them follow each other.
Evisceration and dehiscence.
Evisceration and dehiscence.
And dehiscence. That is the meaning of rectus abdominis. These people are crazy. They really want to drive us nuts. Honestly. It is still dehiscence and evisceration that you know. Just guide the abdominal region is important. As long as you know that, as fast as possible. Rectus abdominis. We go further. Acyclovir, VIR. So is the agent of choice for which of the following infection? So we use it most for herpes. Candida is a fungal infection. A question like this, I don't need content. I can use test taking strategy. Those ones that we have to use strategy, let's strategize. Those ones that we have to go and cram all our content, let's cram. I mean, like cardiac rhythm. There's no test taking strategy for cardiac rhythm. You must have seen those cardiac rhythm before and pass it. There's no test taking. But this one, I can use it. HIV is also AIDS. But it is similar in the exam. Those two similar options can never be the answer. That's a giveaway. I will take the two of them out. Now, candida, that is a yeast infection. We don't use VIR for yeast infection. I take it out. Whether D is now the answer or not, I'll just pick it and leave the place. I have tried my best to do a strong elimination strategy. That's a good one. I don't know content. I should be able to also know strategy. I can't be useless in two ways. Never, 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 never. If I don't know content, I still have to try to use a strategy. In the exam, please don't give up on any question. The answer is in front of you, especially those single item engine as well as our traditional questions. Those ones, you can always guess. If your content is failing, you can still figure it out. So in a way like this, if I don't know encyclopedia, I can say HIV and AIDS, the two of you are the same. So why are you coming? They cannot be, it can't be the answer. They can't be confusing like that. Gastroenterologists, the word gastro, entero is the same. Who do we in what situation do we need them? For digestive system. It is not for any other one. Gastro. The patient has been diagnosed to have COPD and congestive heart failure. Patient is having a pounds that is higher to 10 pounds. What is going to be the best? Check the intake and output of the patient's flow sheet. Intake and output. The adult who had been abused as a child is discussing the group therapy, which statement indicates that the client has had insight. I'm not aware of how deep-seated my anger is, but I now realize I was hungry. So if you realize you are hungry, that shows that you have an insight. They don't seek to assess the renal function of the elderly client who is about to receive a medication that is nephrotoxic, all those gentamicin and nephrotoxic. So the following lab should the nurse do. We have established that creatinine is always the number one indicator for kidney problem. Unless they bring, you can now see, I deliberately put creatinine and BUN. This is how the exam operates anytime they are asked some kidney-related problem. And when we're doing the content under our fundamental, I established that it is only if they bring it as select or apply. That is when you will go for BUN as one of the indicator of kidney problem. The only establishing ONLY, absolute, the only indicator for kidney problem is creatinine. Now, BUN is a promiscuous lab. When it's promiscuous, it's everywhere, unreliable lab. Kidney has a problem, BUN will be high. Lungs has a problem, BUN will be high. There's a problem with the liver, you will see high BUN. The muscle is high, is faulty. So BUN is one unreliable lab. It's going to be everywhere. So when they bring it together, if I change this question to SATA, your answer will be the B. If I say select order apply, and I put creatinine, I put BUN as number C, and I continue like that, they're going to take the two. But if they say best indicator for kidney problem, that will be creatinine. Nurses returning call for all this group of people, the one that will die first is A will die first among them. Atrioventricular shunt and all this like vomiting and the likes. A will die first. 10-year-old Jackie is admitted for rheumatoid fever. Patients say I have a sore throat and bed rest privilege is initiated for the patient. What's the best? Check the cardiac status. In rheumatoid fever, it looks like fever. It looks like the word rheumatoid. We've established that it's a cardiac problem. Who can tell us where the microorganism of rheumatoid fever actually came from? Rheumatoid fever. Who can tell us the history? Sore throat. Good job. A streptococcal infection from the sore, from the mouth, or from the respiratory. A streptococcus, the strep throat. Strep throat. So it will go into the heart, and so the first thing to pick is the cardiac problem. The nurse is caring for a patient. Which type of cell is secreting insulin? Insulin is produced by beta cells of islet of Langerhans in the pancreas. B. The client has taken 10% dextrose, is scheduled to receive dilantin at this time. Can we mix the two together? Can we mix together? It's incompatible with dextrose solution. What type of solution is dextrose? Is it hypotonic, hypertonic, or isotonic? Hypertonic. Good job. Hypertonic. 10% is on the high side. Hypertonic. The highest incidence of child abuse occurs in children with which age? At what age? I can be smart about this also. We have 4 to 6, 6 to 10, 10 years, and I'll just go first. Even though the content says that 0 to 3, right? I'll just go for the lowest based on I want to use a strategy. When you're admitting a client to acute care, The nurse talks about a substance abuse based on knowledge that people with psychiatric disorder are more prone to substance abuse. Most of them are substance induced psychosis. Substance induced psychosis. They had the psychosis before. They've been taking medication. They are fine. They now find themselves taking cannabis. They're taking cocaine, all the methamphetamine. It will come up again, even though they are taking their medication, substance induced. With all this story, patient has loss of mobility. All the story, this is a single item engine. I'll just take what I need. Hemiparesis, this and this and this and this, and they say the patient has a non-blanching erythema and the skin is intact. So when the skin is intact, what type of pressure sore is that?
Stage
What is going on in pressure
Stage
sore?
one.
Yeah, stage
Stage
one,
one
the
Stage
skin is
pressure.
one.
intact.
Stage one.
Yeah. Who can tell us what is going on in stage two? Who can tell us? In stage two, what are we, how many layers is affected? In stage one, how many layers is
Two,
affected?
one.
Two layers are affected.
Stage
No,
one
two
is not
layers.
one layer. Okay.
The
Stage two,
first layer is being peeled off.
okay. Stage two, what are we
Dermis
looking
and
at?
epidermis.
Two
Dermis and epidermis.
Dermis and epidermis.
dermis and
Can have blister and it may not have blister already. Stage three, what are we looking for? How many layers?
Three.
Three.
three
One
layers,
stage four.
dermis, epidermis, and
The tissue.
subcutaneous.
And subcutaneous tissue. And that is where we have tunneling and undermining. Okay. Then the last stage, stage four. What are we? How many stages are we? How many layers? What's all of them?
Four.
Four layers,
Dermis,
so four.
epidermis,
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 subcutaneous,
epidermis,
and
subcutaneous, and
and
the
and
tunneling.
the TBN.
muscle
The
tissue.
bone.
And the TBN. Tendon,
Bone and
bone,
tendon.
and
Yeah.
tendon. Good job. Already. Good job. Newborn has been delivered. Who can tell us ABGA? What's the meaning of ABGA? ABGA is ABGA. A is everything. ABGA is ABGA. You just say ABGA. Just use that and you get it. A is appearance. P is the pulse. G is the grimace. A is activity. And R is the reflex action. You can just use ABGA to get your answer. Right. So here goes for it. That is all encompassing. The patient is going for all this. The nurse know that the client is frequently startled by noises in the hall. So with all this, a rapid speech, a trembling hand, a tachycardia, we just say the patient has a severe anxiety. Severe anxiety with all the stories that we have there as the case study. The client has experienced a CVA, has some hemiparesis. To provide optimal continuity of care, what should the nurse should do all of the following, except. So you will always see that when they want to make the option, the question negative, the except and none or never is going to be towards the tail end, and which people are not going to go by that. The moment you start reading, everything was becoming positive, positive, positive. So they will now say all of the following, except many people don't change. They don't change with them like that. So please get ready when you see the word except and none and the likes. So we have the physician phone a report to the receiving facility. It's not your work to be calling doctor. Can you make sure you call the people that are receiving the patient that this is what the patient is going to take? No, she's not going to do that. She will document, she will copy appropriate part of the medication and transport, to ensure that patient is transported, phone report to the facility. Now telling the doctor, can you tell the facilities that the patient is coming? It's your job as a nurse. You won't do that. You are not going to tell the doctor to do that. So a client has a chronic renal failure, which of the following sexual complications will be the problem of the patient. Always iron blood testosterone, a low testosterone. Testosterone is the hormone of male. It's the one that makes them to have all the driving forces and the secondary sexual characters. An example of a process standard on a med surg unit. This is also all these are management questions. A process of changing IV tubing, teaching people on how to do it. That is a process. What is the process that is going on? And lastly, a month after receiving a blood transfusion, an immunocompromised client developed fever. The patient is having all these signs and symptoms. The nurse should suspect the client has what? Basically, it's going to be the body is reacting to it. Basically, the body is reacting. So I guess we are done. So people can now ask their question. So somebody need our help she has passed the exam like about she did the exam, she passed like maybe 2 years ago. If she's here, she will come to talk. So it's beyond me. I don't know how to. I said maybe people have the same, they have friends that have the same problem and you can tell her what to do. So she called me yesterday and she said, "Oh, Dr. Kenny, I have issues." What's the issue? They sent me a message and I wanted to renew my license, and they said I cannot renew my license. That the school that I went to, the school is closed. They said that they got to know that they didn't go for clinicals. So they allowed her to use the license for 2 years. When she wanted to renew, they didn't allow her to renew. They made the license encumbered. They did not make it to be active anymore. So even the other places that she endorsed, those one automatically also stopped the license. So when she called me, I was devastated. Yeah. So she would just, if you have anybody, if you have heard of that before, somebody has passed, he has used the license for 2 years, she want to renew, and not only her, they send messages to all of them that went to that school and they stop all their licenses. So, and that's the reason why I'm telling all of us. So I'm coming, ma'am. So please, I don't know how we are going to help her because she has already passed. She has used the license for 2 years. So I've been hearing so many things, but this one looks is off me more than what I can accommodate. So I told her to come and express herself. We are all families. Let's try to any information you can do to help her to